Hi, my name is Dr. Hauser. Today we're going to talk about the #1 growing sport in America, pickleball. So I can just tell you, I have a clinic here in Southwest Florida, and man, is pickleball hot. And definitely those people who play pickleball, it's absolutely enhancing their quality of life. So if you haven't tried pickleball, would really recommend it. I played it for the first time just to see what it is because I knew I was going to do a video on pickleball injuries. The structures that keep the bones together, they're called ligaments. And if you said, what's the weak link when you sit in a chair? What's the weak link when you open up a cabinet door? You would say it's the screws. I mean, recently we put together some chairs for the office, and I think the maximum weight was like 300 pounds or something. And it was crazy. All it was 4 little screws. Those 4 little screws have to handle 300 pounds of weight. And anyone who's had they open up a cabinet door and it's loose, it's always the screw. The screw causes the hinge to be loose, which then causes the door to jingle. So in the human body, what causes the looseness in the joints or what causes chronic pain, it's an injury to the ligament. The ligament's either degenerated, the ligament's torn. At minimum, we would call it ligament dysfunction. Ligament dysfunction. So ligament dysfunction is the ligament isn't holding the bones properly. The bones are allowed, because of the ligament dysfunction, they're allowed to move in destructive ways, and they can destroy the joint. They will cause the muscles then to tighten to limit the joint, and then ultimately, if it's not treated properly, and I believe the treatment of ligament injuries is prolotherapy, if it's not treated properly, you'll get a condition which I call whole joint organ gangrene. You know it as osteoarthritis or degenerative disc disease or degenerative arthritis. But when you look at it under a microscope, when a joint is degenerated, and degeneration to me means death of cells, right? So when all the cells of your foot are getting degenerated or the cells are dying, we call that gangrene. So in a joint that has ligament injury, basically the tendon cells die, the ligament cells die, the cartilage cells die, even the bone or the bone marrow gets bone marrow lesions, part of those cells start dying. So that's why I call it whole organ gangrene. So you have to say to yourself, well, what's causing that? Well, what's causing that is these structures are getting too much pressure. So what's the person to do? What, sit on a couch, then they get no pressure? I don't think that's the right thing. You should say they're getting too much pressure because the bones are moving in destructive ways. So what's causing the movement of bones in destructive ways? It's ligament dysfunction. The ligaments aren't tight, they're not thick, they're not strong. They're weak, they're degenerated, they're torn, so you have to repair them, and the way you repair them is with prolotherapy. We see pickleball injuries and see there's a guy dressed in yellow that you might say, that kind of looks like Dr. Hauser. So for this video specifically, I wanted to show you how to get injured with pickleball. Okay, so now this is Pastor Russ, my buddy. This is my first time playing pickleball. You see the ball going over there, and you'll see there's no way this guy is going to get that ball, let alone win the point, but let's just see what happens. That was awesome. My hand scraped up and everything. Like, it still hurts a little bit. Fortunately, I didn't break my injection hand, which I could have, but you saw that I got the point. So literally, this is the funny thing about that. The score after this shot was 1-0. So that was my very first point that I ever won in pickleball, was that point. And I was watching a movie yesterday. It was a great movie, A Million Miles Away. It's just a spectacular movie. I'd recommend anybody watch that movie because it's about the first migrant worker, Mexican worker that became an astronaut. It is, like, you would love it too. It's just an amazing movie. So they said in the movie, tenacity is a superpower. So didn't you just see a really good example of tenacity? But basically, it's kind of true. Like, we play these sports and we do crazy things. Like, what am I diving? I get a fracture in my wrist or something. So that's why Pastor Rusty doesn't dive for stuff. So he stopped the whole thing like, oy, oy, oy. So, you know, you could see common injuries with pickleball is obviously going to be ankle sprains, upper extremity injuries, Achilles, elbow. You know, senior males were 3.5 times more likely than females to suffer a pickleball-related strain or sprain. And you might say why that is probably because guys are dumb and women are smart. You know, I hate to say that, but really, would Marion do that like her first time playing pickleball? No, but Ross does it. So I played for the first time. I think the first game he won 11-6, but the second game I beat him like 14-12. Man, it was marvelous. So basically, you know, so obviously pickleball, there's rackets where you just go like that. Then Pastor Russ has a racket where you turn a lot. Like, they're obviously, let's be honest, like a lot of it's going to be elbow problems. So when the elbow turns, the radius turns, and basically that puts a lot of strain on the various ligament support of the elbow. And then when the ligament support is dysfunctional, and on the lateral side, it's the radial collateral ligament and the annular ligament. On the inside here, it's the ulnar collateral ligament. And then if this bone's moving too much, it's obviously going to affect the extensor tendons or the tendons of the elbow that move the joint. And then eventually you get a tear. So in the office, we do ultrasound exams so we can see the tears. So we don't just treat the tears, we treat the underlying joint instability too, and that's kind of a key component. We find that tendons typically don't tear on their own unless there's an underlying joint instability that weaken the tendon, and then the tendon eventually tears. And then, you know, you can poke on it. You can do this yourself. Like, if you have pain, and you'll see that almost always the pain is right near the joint. So, you know, then we treat not just the elbow tendon where they attach, but also the elbow. And this is what we do. We do ultrasound. This is Danielle. And then we'll see whether the tendon is okay, are the ligaments okay, and then we'll do stressor maneuvers and see if the joint opens up. And if the joint opens up, that's called ligamentous elbow instability. And then prolotherapy is done where the ligaments attach to the bone. So ligaments, you should think of them as a mesh. And you'll hear me talk a lot about the capsular ligaments. So the capsular ligaments are the ligaments that surround the joint. So that's why there's so many shots, because it's like spot welding. So there's like there's a shot here, shot there, shot there, shot there, shot there. And we use solutions that stimulate healing. So one of the solutions we use is D-glucose or dextrose, which is the normal sugar in the body. And sometimes we'll draw blood and we'll spin the blood down and get the platelets, which contain the growth factors. And then we'll inject those into the injured areas. And then once the ligament is tight and thick and strong, then the ligament dysfunction stops. The joint bones move in the proper ways, then the forces on the structures of the joint are normal, and then the pain goes away, and man, your pickleball playing gets way, way better. The question we often get is, can I still play pickleball if I'm really injured? Well, normally by the time somebody's seeing us, Danielle or I, at Caring Medical here in Fort Myers, Florida, you know, like, you have an injury. So, you know, when you have an injury, you have to then cross-train. So I really recommend, it's not that somebody can't work out, it's just that why not work on your endurance? Like, if, say, somebody while they're getting treated, if they power walked or they jogged and they worked on for 2 months their endurance, well, they're going to play way better pickleball. Or somebody could, you know, work on their balance, right? You know, they could do different maneuvers to work on your balance, get a Bosu ball. Like, there's so many things. See, in sports, we play the sport, we play the sport, we play the sport. But if you really want to get better at the sport, you should do all the things also sometimes to help you with the sport. Like pickleball, it was amazing my first time playing pickleball, how exhausting pickleball was. Now, granted, it's the summer here and we're in Southwest Florida, but boy, I worked up a really good sweat. So if I jogged and I increased my aerobic endurance, as I played more and more pickleball matches, like I wouldn't get tired. And then obviously most sports relate to balance. So as I get older and as you guys get older, your balance goes. So do balance drills. There's just a lot of things somebody can do. So the answer to the question is either way, it's a win. So I tell the patient, if I treat you and you play pickleball, while you're getting treated, I win because you're going to need more visits. So instead of 3 visits getting you better, you might need 6 visits. So I get 3 extra visits out of it. Now, if you don't play pickleball and you get better in 2 months instead of like 6 months, then you win. You need a lot less visits. So obviously there are going to be times where somebody is allowed to play pickleball while they're getting treated, but they would have to wear a brace. So, obviously we take it at each individual. Like if somebody had a big tournament coming up, and they had been training for 4 months for it, of course I'm going to let them play the tournament. But I might have them use rock tape or something. Like, yeah, I'm just thinking about, like, I think it was last year, I had a pretty high level person who had a big tournament, and I let them with their shoulder do rock tape, and I think they made it to the semifinals. So I think they came in 3rd, and it was a national tournament because we have a lot of national tournaments down here. But most of the time it's 3, 4, 5, 6 visits to actually resolve it, because it's different if you have joint instability because ligaments heal so poorly. You got to keep hitting them and stimulate them with prolotherapy to heal. But just letting you know, those sports injuries, those pickleball injuries can easily be treated with prolotherapy.